We're joined now once again by Dr. Gautam Desai, Professor and Chair of Primary Care at Kansas City University, with some insight. So, Dr. Desai, we understand younger people are being detected with much later stages, too. What's going on?
Yeah, nobody really knows for sure. 90% of the time, we'll see colon cancer in patients over the age of 50, but this younger population is getting it more frequently, and they're 60% more likely to have a more advanced stage, which makes it harder to treat. There's a lot of theories about diet, processed foods, activities, but we don't really know for sure, and that's why it's important to be kind of vigilant for symptoms and risks.
Speaking of risk, what are some risk factors of colon cancer?
Yeah, so anybody young or old, there's some risk factors that you can change. And although it's very difficult, you should stop smoking or vaping, try and decrease your alcohol intake, have a nice balanced diet that has a lot of fiber, and try and really watch those processed foods, especially processed meats and red meats, and really get out there and exercise and watch your body weight. Now, there's some risk factors you cannot change, like your age, your family history of cancer, a history of diabetes or inflammatory, bowel disease, or being of certain ethnic or racial background. You can't change.
And I know we always ask you this, Doc, but best age to think about getting a colonoscopy? I know 50 used to be what they used to say. What's the latest?
Yeah, because you just mentioned that younger people are getting it. So what should we do?
Yeah, so now 45 is the new 50 for people that are of average risk. So from ages 45 to 75, you should get screened and then talk to your doctor after 75. And if you're still pretty healthy, maybe keep going till age 85, and you probably don't need to be screened after that. But if you have a higher risk, let's say that your parent had colon cancer at the age of 45, you should get a colonoscopy at age 35. So, talk to your provider. They can talk to you about your risk factors and when you should start screening.
Yeah, because I remember Matt Stewart, as he often says,
right.
His wife had him go in, he was 45, and they found something, Dr. Desai. And luckily, like you've been saying, and in Matt's case, he was very lucky, it was treatable. So it's not something that people should be terrified of doing, right?
Yeah. And this should be men and women.
Correct. It should be males and females, and a lot of people are scared of getting a colonoscopy, like you said, but once you're there, you'll be knocked out. You won't remember anything at all. And a lot of times they can just cut out the polyp if it's there, and that way you'll have a little treatment at the same time.
Yes, if nothing else. I did this within the last year. It was maybe the best nap I've had in a long time.
Way to look at it.
For no other reason.
Absolutely. All right, Dr. Desai, we thank you always when you stop by and have a chat with us and give us some informative information as far as health. Thank you so much.
Hey, my pleasure. You both have a great week.
All right, you
Thanks
too.
a lot, Dr. Desai. All right.